everyone. Good morning, good afternoon, and good evening. Today's topic is Heart Health 2, Measuring and Tracking Heart Health. Our main speaker today is Dr. Rahul Sharma, a well-known cardiologist from Stanford. In addition, we also have other speakers, including Dr. Rajesh Samsuri, Yogendra Babra.
I want to talk to you about a few different things. The heart has four main chambers, the two upper chambers, the atria, and the two bottom chambers, the ventricles. There are four important valves, just like valves in any sort of plumbing system, which allow the passage of blood forward. And they are the pulmonic valve, which separates from the right side of the heart going to the lungs, the tricuspid valve, which is between the upper and lower chamber of the right side of the heart, the mitral valve, which is between the upper and lower chambers on the left side of the heart, and the aortic valve, which allows blood to pass through to the rest of the body. Valves can either be narrowed or leaky or a combination of both. Perhaps one of the most commonly understood disease states is something called aortic valve stenosis. So the aortic valve, as a reminder, is the valve that leads from the left side of the heart when the heart squeezes and pumps through the aortic valve, and blood goes to the brain and the rest of the body. So it's a very important valve.
I'd like to introduce that we have developed a holistic solution for the management and monitoring of patients remotely, with primary focus on the cardiovascular diseases. A device for collecting the body vitals, a mobile device for displaying real-time data, communication purposes, and finally the cloud infrastructure through which we do the data analytics and make the data available to either physicians or anybody who's authorized to monitor remotely. So the key thing is real-time continuous monitoring and analytics of the heart.
How many people and what percentage of people of those aortic valve type valves that are seen in 80s and 90-year-old patients, what percentage qualify for that? And what is the associated comorbidities?
I would say over the age of 75, about somewhere between 6 and 7% of patients will have aortic stenosis. So I would say 90 to 95% of patients we see with severe symptomatic aortic stenosis are eligible candidates for the less invasive transcatheter aortic valve replacement, which I showed. Pacemakers are a potential risk, and it varies depending on the nature of the device we put in, but also where the valve is positioned, and that's related to operator experience. I position my valves higher on purpose to minimize the risk of pacemaker. In the literature, the risk ranges from 6 to 15 to 20%. I will tell you at Stanford, our risk of pacemakers is less than 5% overall. If you are at risk, make sure you have a good cardiologist.